I'm Susan Taylor with Scripps Health in San Diego, California. You're about to get your monthly period, and oh, here it comes again, an awful headache. Why do so many women get headaches around their period, and what can you do about it? Joining us to talk about this is Dr. Emily Engel. She's a neurologist and headache specialist with the Scripps Clinic Medical Group. She is the director of the Dalessio Headache Center at Scripps Clinic. Doctor, thanks so much for being with us.
Thank you, Susan. It's nice to be here.
So, go into a little bit more detail. What is a hormone headache?
So, a hormone headache almost always is actually a migraine. Hormonal changes are a big trigger for migraine, and a big hormonal change is getting your period. So, it's not at all surprising that women with migraine will get a bad headache around their period.
So, what's the difference between a migraine and a regular tension headache?
So, you might be surprised to learn that the most common cause of bad disruptive headache in somebody who's otherwise healthy is actually migraine. It's a very common diagnosis. At least 20% of the population has it. And tension headache is not usually bothersome enough for patients to even really complain about it. So, if a patient comes into my office complaining of headache, it's almost always migraine.
And what are the symptoms?
So the most common symptom of a migraine is the headache. And the headache is often moderate to severe and it can be disruptive. But in addition to the pain, patients will have other symptoms. They'll have sensitivity to light or to sound. They'll sometimes feel nauseated. They'll occasionally vomit. And something that I learned from my patients is that a lot of patients will get dizziness. And the dizziness does not always happen when they're having the head pain. It sometimes can happen separately.
And what about loss of appetite and maybe being sweaty or having chills?
Patients don't typically get sweaty or have chills. And in fact, they often don't lose appetite. And the interesting thing is, patients will often crave sweets as the migraine is first starting. And that craving actually starts before the pain even starts. The body and the brain is aware that a migraine is coming, and patients will sometimes feel sleepy and irritable and hungry. And they crave sweets, especially chocolate. And we think that this is part of the reason that this myth that chocolate is a migraine trigger came from, because patients will crave chocolate, they'll eat it, and they'll still get their migraine. And then they say, oh, darn it, the chocolate caused my migraine.
So, the symptoms that you get when you're having a hormone headache, when do they happen and how long do they last?
So it depends on the woman, specifically for the period migraines. Some women it happens the day before the period, some women it happens the first day of the period, and some it happens the last day of the period. So if we can identify when in the cycle the migraine reliably happens, we have some nice techniques that we can teach our patients so that they can hopefully avoid the migraine from even happening.
What kind of techniques are you talking about?
Some patients can take their migraine medicine the day before their period starts, for example, and they can keep the migraine from happening. Also, we found that women who get their migraines on the last day of their period, it seems to somewhat be related to low iron due to the blood loss. And if we have our patients take some iron supplementations during the period, it sometimes will keep them from getting the headache. So there are lots of techniques and tricks that we've learned through the years to minimize the suffering.
Why do so many women get headaches around their period? Why does this happen? What causes it?
Because change is one of the biggest triggers for migraine. And around the period, there is a change in hormones. So, one of the changes that happens is the estrogen level drops, and the brain is very sensitive to even subtle hormonal changes. And then, what we see later in the life cycle, with perimenopause especially, is there are a lot of changes in the hormone levels that happen on almost a daily basis, not just around the period. And so, no surprise, patients start having a headache almost every day during perimenopause.
And can you also get these hormone headaches during pregnancy and menopause?
Yes, so the typical pattern during pregnancy is that during the first trimester, the headaches become a bit worse because, again, the hormones are changing quite a bit during the first trimester. Often and hopefully in the second and third trimester, when the hormones have stabilized quite a bit, especially the estrogen, the headaches often get quite a bit better, which is very good for patients, of course.
And how do you diagnose these hormone headaches?
So they're pretty straightforward questions that we ask our patients that can help with the diagnosis of migraine. And as we talked about, migraine typically is a hormone headache. If the patient does not have any what we call red flags, meaning concerning aspects to their history, and if they have a normal exam, then we don't typically feel that further testing is necessary. If I'm concerned about a patient and think, for example, that they need imaging of their brain, then typically what I would recommend would be an MRI.
And what can you do to treat these headaches? I mean, you talked about a little bit about some kind of medication. How do you find relief? What are the medical treatments?
So we certainly address lifestyle factors and to minimize your risk of migraines, to minimize change, in addition to looking at the hormones, we talk to patients about going to sleep at the same time, waking up at the same time, not going hungry, not skipping meals, trying to have the same amount of stress every day if possible. And one way to help with that is to get the same amount of exercise every day. So we definitely address these lifestyle factors, which have been proven to be triggers. If lifestyle factors are not enough to control it, then many patients, most patients actually, tend to need medications. And there are some over-the-counter medications that sometimes work. And we have a lot of as needed prescription medications as well as preventive prescription medications that we make available to our patients, and we have a lot of success.
And what about the relationship between headaches and taking birth control pills, or once you're in menopause, taking hormone replacement therapy?
So, good question. So, if we go back to how change is a trigger for migraine, a lot of women will notice when they're, say, in their 20s or 30s and they're taking the oral contraceptive pill for birth control, that when they start the pill, they start having worsening migraines. That doesn't mean that they can't be on the pill typically. It often means that they just need a few weeks or a couple months for their brain to catch up and adjust to this change, and then they often do just fine. And along those lines, some women also might feel that they need to stay on the pill because when they've stopped it in the past, their migraines have flared up. But again, a little bit of education about just being a little patient for a few weeks or even up to 2 months to give the brain a chance to catch up. Once it has adjusted to that change, often the migraines diminish. Now, perimenopause and menopause is a really hot topic these days. I'm not sure if you've been following it, but the thinking is really changing. And it's really nice because we found that there are a lot of really beneficial hormonal treatments that many women can take to help them in perimenopause. About 20 years ago, a study came out which scared a lot of doctors and patients away from hormones. But now what we know is it's been taken, as it's been looked at more closely, is that topical hormone replacement, meaning through the skin in the form of a cream or a patch, for most women is actually very safe and very effective. And so I like to work closely with my colleagues in gynecology on this. I have a lot of women who come see me in their mid to late 40s with worsening of their migraines. And often they benefit from an intervention such as a hormone patch, which again, I don't prescribe, but my gynecology colleagues do. And we work very closely together, and these patients feel a lot better because not only do their headaches decrease in frequency, but their night sweats and hot flashes and mood swings go away, and they really have an improved quality of life.
Is there any way to prevent these headaches?
To try to keep every day exactly the same. And so not easy to do. And a lot of people have a genetic predisposition towards migraine. And so they got this gene from one of their parents. It's a pretty common problem. It's not super common that we can make it go away completely, but we can get it under excellent control so that it's not disabling and it's not disruptive.
Do these headaches go away once you reach menopause?
Another good question. So, what we know about menopause is that it doesn't happen on one day. When I was in medical school, literally all they taught us was at 50, the period stops. But in fact, the reality is that for the 10 years leading up to 50, there's all kinds of hormonal shifts that happen. And for about 10 years after the period stops, the hormones are continuing to shift and have transitions. So it's really about a 20-year process, the whole menopausal transition. And so during that time, it's important to work closely with your gynecologist and your primary care doctor and your neurologist or headache specialist to make sure that you're not suffering and that your symptoms are well controlled.
So once you hit menopause, once you reach it, would you kind of taper off the hormone headache drugs over a period of time?
So often we can. And the issue of the hormone replacement, I defer that more to the gynecologist. And some patients do well staying on it for a while after menopause, some get off it sooner. And we find that patients need their migraine specific preventive medications not forever, maybe for 5 or 10 years after menopause. And after that time, we often can stop it.
What's the one thing you wish every woman should know about hormone-related headaches?
They're not alone. This is a really common problem and it's very treatable. And I feel very strongly that people should not be suffering.
Any final thoughts, doctor?
Yes, I'm so happy that I had the opportunity to speak about this because it's a very common condition. As you know, 50% of the population is women, and most women get hormonal headaches. So this is not an unusual condition at all. And you shouldn't be suffering if you're having headaches and you're not able to manage them. I recommend that you reach out to your primary care doctor for treatment, and if necessary, seek care from a specialist.
Doctor, thanks so much for being with us. We appreciate you taking the time.
My pleasure, Susan. It was really nice to see you again, and I appreciate this opportunity.
If you want more information on how to diagnose and treat hormone headaches, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.